Did you know that over 80% of adults deal with some form of hyperpigmentation, like dark spots or melasma? If left untreated, these spots can actually get worse and become harder to remove. Dark spots and melasma don't just affect how your skin looks. They can also impact your confidence and daily life. Many people try different products without seeing real, lasting results. In this video, we're breaking down 5 proven treatment methods recommended by skin experts that can help you understand and effectively tackle hyperpigmentation. If you're struggling with dark spots or melasma, drop a comment below. Let's talk about what's worked for you or answer any questions you have. First, it's important to understand the 2 main types of hyperpigmentation so you can choose the right treatment for your skin. Hyperpigmentation refers to the darkening or discoloration of certain areas of the skin due to excess melanin production. Melanin is the natural pigment responsible for the color of our skin, hair, and eyes, and it plays a protective role by absorbing ultraviolet, UV, radiation from the sun. However, when melanin is produced unevenly or accumulates excessively in patches, it results in visible dark spots or blotches known as hyperpigmentation. There are 2 primary types of hyperpigmentation that commonly affect adults, especially women in midlife and beyond: solar lentigines, commonly called age spots or sunspots, and melasma. Solar lentigines, age spots/sunspots, develop as a direct consequence of chronic sun exposure. The ultraviolet rays from the sun stimulate melanocytes, cells in the skin that produce melanin, to generate more pigment in localized areas. These spots typically appear as well-defined, round, or oval patches with a darker brown color. Because they form in the superficial layers of the skin, they often respond better to topical treatments and certain in-office procedures like laser therapy or chemical peels. You're most likely to see these on the face, hands, shoulders, and other sun-exposed areas. Although they are harmless from a medical standpoint, their cosmetic impact can be significant, especially when they accumulate over time. Melasma, on the other hand, is a more complex and often more stubborn type of hyperpigmentation. It usually manifests as larger, irregularly shaped patches that are often symmetrical, appearing on both cheeks, forehead, and sometimes the upper lip. Unlike sunspots, melasma is primarily driven by hormonal influences: pregnancy, often called the mask of pregnancy, birth control pills, hormone replacement therapy, or fluctuating hormones during menopause. Studies suggest that melasma involves deeper layers of the skin, which explains why it's often resistant to standard treatments that work on superficial discoloration. One important feature of melasma is its tendency to fluctuate, sometimes worsening with sun exposure or hormonal changes, then partially fading. This waxing and waning can be frustrating for many women, especially as they age and experience shifts in hormone levels. Moreover, genetics and skin type also play roles. Melasma is more common in women with darker skin tones, but can affect all ethnicities. Understanding these differences is crucial because treatments effective for one type may not work or may even worsen the other. Proper diagnosis by a board-certified dermatologist is vital before starting any treatment. Misidentifying the type of hyperpigmentation can lead to ineffective or even harmful interventions. For example, some procedures that clear sunspots may aggravate melasma. In summary, hyperpigmentation is a multifaceted skin condition influenced by sun exposure, hormonal factors, and individual genetics. Recognizing whether your pigmentation is due to sunspots or melasma lays the foundation for choosing the right treatment approach that leads to clearer, more even-toned skin. Treatment option 1. Hydroquinone, power and controversy. Hydroquinone has long been regarded as one of the most potent topical treatments for hyperpigmentation, especially for stubborn melasma and dark spots caused by sun damage. Its primary function is to inhibit tyrosinase, an enzyme essential in the production of melanin, effectively reducing pigment formation in the skin. How hydroquinone works? By blocking tyrosinase, hydroquinone prevents melanocytes from producing excessive melanin in affected areas. This action gradually lightens dark patches, restoring a more even skin tone. Available in both over-the-counter formulations, usually 2%, and prescription strengths, up to 4% or higher. Hydroquinone remains a cornerstone in dermatology for pigment correction. Scientific support and clinical use. Numerous clinical studies validate hydroquinone's efficacy. For example, a 2015 review in the Journal of Clinical and Aesthetic Dermatology highlighted hydroquinone as the gold standard for melasma treatment, citing significant improvements in pigmentation with consistent use over 8 to 12 weeks. It often forms part of combination therapies, mixed with agents like retinoids or corticosteroids to enhance effectiveness and reduce irritation. Controversies and safety concerns. Despite its widespread use, hydroquinone has faced scrutiny. Animal studies from decades ago suggested a carcinogenic risk when applied in extremely high doses over long periods, particularly in rodents. However, human studies have not demonstrated a clear cancer risk at dermatologically recommended concentrations. Because of these concerns, regulatory agencies have taken different stances globally. The European Union banned hydroquinone in cosmetic products, citing precautionary principles, while in the United States, non-prescription 2% products were removed from the market in 2020 as part of legislative reforms. Prescription 4% formulations remain available, but under strict medical supervision. Moreover, hydroquinone use requires caution because prolonged application can sometimes cause exogenous achromatosis, a paradoxical darkening of the skin that is difficult to treat. Skin irritation and allergic reactions are also possible, particularly in sensitive skin types. Practical recommendations. For women seeking effective treatment, hydroquinone is best used under a dermatologist's guidance. Typically, a treatment course lasts up to 6 months, after which a break or maintenance therapy with gentler agents is advised to minimize side effects. Combining hydroquinone with exfoliating agents such as retinol or mild alpha-hydroxy acids can accelerate results, improving skin cell turnover and pigment shedding. However, these combinations should be customized to avoid over-irritation. Consider the experience of Janet, a 62-year-old retired teacher who developed extensive age spots and melasma patches following decades of sun exposure and hormonal changes after menopause. After consulting with her dermatologist, Janet was prescribed a 4% hydroquinone cream paired with a gentle retinol moisturizer. Within 4 months, Janet noticed a remarkable reduction in the darkness of her spots, and her skin appeared more radiant and even-toned. Importantly, her dermatologist closely monitored her skin to avoid any signs of irritation or achromatosis. Janet's story underscores that while hydroquinone carries risks, careful professional use can deliver significant benefits. Treatment option 2. Alternative brightening agents, Kojic acid, Niacinamide, Licorice root. For those seeking effective but gentler options than hydroquinone, several alternative brightening agents have gained popularity due to their safety profiles and ability to reduce hyperpigmentation over time. Kojic acid is a natural compound derived from certain fungi and fermentation processes. It inhibits tyrosinase, the same enzyme targeted by hydroquinone, thereby reducing melanin production. Kojic acid is frequently found in serums and creams marketed for skin brightening. Clinical studies have demonstrated its ability to lighten sunspots and melasma with consistent use, though results typically appear more gradually than with hydroquinone. Its antioxidant properties also help protect skin from free radical damage. Niacinamide, a form of vitamin B3, offers a unique mechanism. Instead of blocking melanin production, it prevents the transfer of pigment-containing melanosomes from melanocytes to surrounding skin cells. This reduces visible darkening without interfering directly with melanin synthesis. Niacinamide also supports skin barrier function and reduces inflammation, making it ideal for sensitive or aging skin. Research published in the British Journal of Dermatology highlights niacinamide's ability to improve pigmentation, texture, and overall skin tone after weeks of application. Licorice root extract contains a molecule called glabridin, which has anti-inflammatory and tyrosinase-inhibiting effects. It has been used in traditional medicine and modern skincare for its brightening and soothing properties. Unlike some harsh lightening agents, licorice root extract is well tolerated and suitable for long-term use. While these agents may take longer, often several months, to show visible improvements, their safety for prolonged use is a significant advantage. Women in their 50s and 60s often prefer these options to minimize irritation and maintain skin health over time. Practical tip: combining these ingredients in a daily regimen, along with diligent sun protection, can gradually even out skin tone and enhance radiance without the risks sometimes associated with stronger bleaching agents. Treatment option 3. Vitamin C, antioxidant, and brightening effects. Vitamin C is widely celebrated in skincare for its powerful antioxidant properties and its ability to brighten the skin. Beyond its role in supporting immune function, vitamin C directly influences melanin synthesis, making it an essential ingredient in hyperpigmentation treatment. The key to vitamin C's brightening effect lies in its capacity to inhibit tyrosinase, the enzyme responsible for melanin production, much like hydroquinone and kojic acid. Additionally, vitamin C neutralizes free radicals, unstable molecules generated by UV exposure and environmental stress that can damage skin cells and exacerbate pigmentation. Two primary forms of vitamin C are commonly used in topical skincare. L-ascorbic acid is the most studied and potent form. It is highly effective at concentrations between 10% and 20%. However, L-ascorbic acid is unstable and prone to oxidation, which can reduce its efficacy. It may also cause irritation, especially for sensitive or mature skin. Sodium ascorbyl phosphate is a more stable derivative with lower irritation potential. Although slightly less potent than L-ascorbic acid, it offers consistent results and is gentler, making it an excellent choice for those with sensitive skin or for daily use. Scientific studies support the use of vitamin C serums in improving skin brightness and reducing hyperpigmentation over time. Regular morning application is advised, as vitamin C also enhances the effectiveness of sunscreens by neutralizing oxidative damage. A practical example is the use of a vitamin C serum alongside other brightening treatments. For instance, combining vitamin C with niacinamide or mild exfoliants can provide synergistic benefits, improving both pigmentation and skin texture. For mature women, incorporating vitamin C into a daily routine not only targets discoloration, but also supports collagen synthesis, promoting firmer, more youthful skin. Remember, always choose vitamin C products in opaque, airtight packaging to preserve stability, and apply them before moisturizer and sunscreen for optimal absorption and protection. Treatment option 4. Tranexamic acid, a new contender. Tranexamic acid, TXA, has recently emerged as a promising treatment for melasma and other forms of stubborn hyperpigmentation. Originally developed to reduce bleeding by promoting blood clotting, TXA's unique effects on pigmentation have captured the interest of dermatologists worldwide. TXA works by inhibiting plasminogen activation, which in turn reduces the release of inflammatory mediators triggered by UV exposure. This pathway is important because inflammation is a key driver of melanin production in melasma-affected skin. By dampening this inflammatory response, TXA helps to calm melanocyte activity and reduce pigment formation. Clinical studies support the safety and effectiveness of both oral and topical forms of TXA. For instance, a 2017 randomized controlled trial involving Asian patients with melasma showed significant improvement after 12 weeks of oral TXA therapy, with 65% of participants experiencing excellent to good results. Topical TXA, meanwhile, is gaining popularity as a less systemic alternative with fewer side effects. Despite its benefits, TXA is a prescription medication and should be used under the guidance of a healthcare professional, particularly the oral form, which carries potential risks such as blood clots in susceptible individuals. Topical formulations are generally considered safer and suitable for longer-term use. For women battling persistent melasma, especially when hormonal influences complicate treatment, TXA offers a novel, science-backed option that complements existing therapies like hydroquinone or vitamin C. Example: Sarah, a 54-year-old woman whose melasma worsened with hormonal changes during menopause, found limited success with traditional creams. Under her dermatologist's supervision, she began oral TXA alongside sun protection and vitamin C serums. After 3 months, her skin showed significant lightening with minimal side effects. TXA's rise in dermatology highlights the importance of evolving treatment strategies tailored to the complex nature of hyperpigmentation. Treatment option 5. Sun protection. The most important step. No discussion of hyperpigmentation treatment is complete without emphasizing sun protection. It is by far the most critical factor in both preventing and managing dark spots and melasma. Ultraviolet UV radiation from the sun stimulates melanocytes to produce more melanin, directly causing or worsening pigmentation. Even the best topical treatments will be less effective if sun exposure continues unmitigated. For most women dealing with age spots or sunspots, a broad-spectrum sunscreen with an SPF of 30 is generally sufficient. However, those with melasma or highly photosensitive skin should use a sunscreen with SPF 50 or higher for better protection. It's also important to choose sunscreens free of certain chemicals like oxybenzone and octinoxate, which recent research suggests may disrupt hormones and potentially worsen pigmentation issues. Mineral-based sunscreens containing zinc oxide or titanium dioxide are safer alternatives. Beyond sunscreen, additional sun-safe habits include wearing wide-brimmed hats and protective clothing, seeking shade during peak UV hours between 10 a.m. and 3 p.m., reapplying sunscreen every 2 hours, especially after swimming or sweating. Interestingly, while sun avoidance is critical, moderate sun exposure, about 15 minutes in the morning or late afternoon, is beneficial for vitamin D synthesis and circadian rhythm regulation. Balancing sun safety with these health benefits is an important part of comprehensive skincare. In summary, diligent sun protection is the foundation upon which all effective hyperpigmentation treatments build. Without it, dark spots are likely to persist or return, regardless of other therapies used. Additional treatments: IPL and cautions for melasma. Intense pulsed light, IPL, therapy is a popular in-office treatment for hyperpigmentation, especially effective at reducing superficial sunspots and age spots. IPL uses broad-spectrum light to target and break down excess melanin, leading to clearer skin after several sessions. Many patients appreciate IPL for its relatively quick results and minimal downtime. However, IPL is not suitable for everyone, particularly those with melasma. Because melasma involves deeper pigmentation and is influenced by hormonal and inflammatory factors, IPL can sometimes worsen the condition by triggering skin irritation and inflammation. This paradoxical darkening, known as post-inflammatory hyperpigmentation, is a risk if IPL is used indiscriminately. For patients uncertain about their pigmentation type, it is critical to consult a board-certified dermatologist before pursuing IPL or laser therapies. Proper diagnosis ensures safe, effective treatment tailored to the pigmentation's nature. Special considerations: menopause, skin changes, and lifestyle. Menopause brings hormonal shifts that profoundly impact skin health, often exacerbating hyperpigmentation. Declining estrogen levels reduce collagen production, skin thickness, and moisture retention, resulting in dryness, sensitivity, and slower cell turnover. These changes can make pigmentation more noticeable and resistant to treatment. Women in perimenopause and menopause should adjust their skincare routines accordingly, opting for nourishing, hydrating products and gentle exfoliants to support skin renewal without irritation. Incorporating antioxidants and barrier-strengthening ingredients helps maintain skin resilience. Lifestyle factors also play a key role. A diet rich in antioxidants, omega-3 fatty acids, and vitamins supports skin health from within. Regular physical activity improves circulation, aiding skin repair. Stress management and quality sleep are equally important since they influence hormone balance and skin repair mechanisms. Combining thoughtful skincare with healthy habits maximizes the chances of maintaining youthful, even-toned skin through menopause and beyond. Case studies and real-life examples. To illustrate how these treatments work in real life, consider two examples. Angela, 60, with sunspots. After decades of gardening without sunscreen, Angela developed numerous dark spots on her face and hands. She began a daily regimen using niacinamide serum and strict SPF 50 sun protection. Within 6 months, her spots noticeably faded and her skin texture improved. Angela's experience highlights how consistent use of safe brightening agents combined with sun protection can reverse sun damage gradually. Susan, 55, with melasma postmenopause. Susan struggled with melasma patches that intensified after stopping hormone therapy. Initial attempts with over-the-counter creams failed. Her dermatologist prescribed a 4% hydroquinone cream, supplemented with vitamin C serum and oral tranexamic acid. Over 5 months, Susan's pigmentation lightened significantly and flare-ups reduced. Regular follow-ups ensured safe use and minimized side effects. Susan's journey demonstrates the value of medical supervision and combination therapy for complex pigmentation. These stories emphasize that hyperpigmentation treatment requires personalized strategies, patience, and professional guidance to achieve lasting results. Hyperpigmentation, whether sunspots or melasma, is a multifaceted condition demanding tailored treatment. Hydroquinone remains a powerful option, but must be used cautiously. Safer alternatives like Kojic acid, niacinamide, and vitamin C offer gentle, long-term benefits. Emerging treatments like tranexamic acid show promise, especially under medical supervision. Most importantly, consistent and effective sun protection is the foundation of all pigmentation management. Women navigating menopause should adopt supportive skincare and healthy lifestyles to optimize results. With knowledge, patience, and professional care, achieving brighter, rejuvenated skin at any age is well within reach.